Did you know that severe allergies have spiked by 50% over the last decade? This huge increase really puts the spotlight on the growing risk of life-threatening reactions that more and more people are facing nowadays. It's more important than ever to recognize the warning signs of severe allergies. Severe allergies can kick in suddenly and get worse really fast, so knowing what to look out for is key. Being able to spot these signs quickly could literally save lives. Allergies aren't just a minor inconvenience. They pose serious health risks and can majorly disrupt daily life. Whether it's struggling to breathe, dealing with severe skin reactions, coping with abdominal pain, or feeling dizzy, the impact of severe allergies is extensive. These symptoms can mess with your ability to work, socialize, and even do everyday tasks. For those with severe allergies, the danger of anaphylaxis, a potentially deadly reaction, is always a concern. This calls for quick medical action, highlighting just how crucial it is to be well prepared and informed. Stick around as we cover the 9 crucial warning signs of severe allergies that everyone should be aware of. Number 1, anaphylaxis. Did you know that anaphylaxis is a severe, potentially life-threatening allergic reaction that can hit rapidly after someone encounters an allergen? This intense reaction can affect multiple systems in the body, causing symptoms like difficulty breathing, throat swelling, and a sudden drop in blood pressure. These symptoms can worsen quickly, so it's crucial to recognize them early. Common triggers include foods such as peanuts, tree nuts, shellfish, and certain medications, as well as insect stings. The first signs of anaphylaxis might be a feeling of warmth, hives, and skin redness. As the reaction intensifies, the person might experience facial swelling, a tight throat, and a looming sense of doom. The respiratory issues can include wheezing, shortness of breath, and trouble swallowing. Cardiovascular issues like a rapid or weak pulse and low blood pressure might follow, potentially leading to shock. It's critical to treat anaphylaxis immediately with an epinephrine auto-injector and then seek emergency medical help. Without quick action, anaphylaxis can cause loss of consciousness and even death, underscoring the need for a fast response. Number 2, swelling of the face, lips, or throat, angioedema. Angioedema causes rapid swelling in the deeper layers of the skin, often affecting the face, lips, and throat. This condition can strike suddenly and without warning, usually in response to allergens like certain foods, medications, or insect stings. Unlike hives, which only affect the skin surface, angioedema targets deeper tissues and can be more severe. This swelling can be really uncomfortable and even disfigure the affected areas. When it affects the throat, it becomes a serious issue by potentially blocking the airway, making it hard or even impossible to breathe. This situation can quickly turn into a medical emergency. Other symptoms might include swelling of the hands, feet, or genital areas, and sometimes it comes with abdominal pain. Treating angioedema involves identifying and steering clear of triggers. During acute episodes, doctors might administer antihistamines, corticosteroids, and epinephrine to reduce swelling and prevent it from getting worse. Managing chronic cases might require long-term strategies. Recognizing and quickly responding to angioedema is key to preventing serious complications, especially those that can affect breathing. Number 3, severe skin reactions. Severe skin reactions like extensive hives and eczema can signal a serious allergic response. Hives, or urticaria, appear as raised, itchy welts that can spread across large areas of your body. These welts can vary in size and sometimes join together to form even larger patches. Unlike the milder versions, severe hives are usually widespread, intensely itchy, and can cause a lot of discomfort. Eczema, also known as atopic dermatitis, in its severe form during allergic reactions, shows up as red, inflamed, and itchy patches of skin. These patches can crack, ooze fluid, and be incredibly painful. Severe eczema can really affect your quality of life, leading to sleep problems and increased stress. Both hives and eczema can be triggered by various allergens, including certain foods, medications, and environmental factors. In severe cases, these skin reactions may occur alongside other symptoms of a systemic allergic response, such as difficulty breathing or swelling of the face and throat. Treating severe skin reactions usually involves antihistamines to reduce itching and inflammation, corticosteroids to control severe inflammation, and avoiding any known allergens. If the skin reactions are part of a broader anaphylactic response, emergency treatment with epinephrine becomes necessary. It's crucial to recognize and treat severe skin reactions quickly to prevent further complications and relieve discomfort. Number 4, difficulty breathing and wheezing. Difficulty breathing and wheezing are alarming symptoms that often point to a severe allergic reaction, like anaphylaxis or asthma triggered by allergens. These respiratory symptoms can come on quickly and demand immediate attention. Common culprits include pollen, pet dander, dust mites, certain foods, and insect stings. When you're exposed to an allergen, your immune system reacts by releasing chemicals like histamines, which cause inflammation and narrowing of the airways. This leads to symptoms such as wheezing, a high-pitched whistling sound when you breathe, along with shortness of breath, chest tightness, coughing, and a feeling of being unable to breathe properly. In severe cases, the airways can become so tight that breathing turns extremely difficult or even impossible. This can lead to hypoxia, where your body doesn't get enough oxygen, which might cause loss of consciousness or even death if not addressed quickly. Immediate treatment typically involves using an epinephrine autoinjector if anaphylaxis is suspected. Inhalers that contain bronchodilators might also be used to help open up the airways. It's critical to seek emergency medical help right away to get the right care and monitoring. Recognizing and treating symptoms like difficulty breathing and wheezing promptly is key to preventing life-threatening complications. Number 5, abdominal pain and vomiting. Did you know abdominal pain and vomiting are major red flags for a severe allergic reaction? They're often linked to food allergies or anaphylaxis. These symptoms can pop up shortly after you come into contact with an allergen and might also come with other signs like hives, swelling, and difficulty breathing. When you eat something you're allergic to, your immune system can react pretty intensely, causing inflammation and irritation in your digestive tract. This can trigger severe stomach cramps, nausea, vomiting, and sometimes even diarrhea. The pain can be really sharp and severe, seriously messing with your day-to-day life. In severe cases, these symptoms can quickly get worse, leading to dehydration and shock. If you're experiencing abdominal pain and vomiting along with other serious allergy symptoms like facial swelling or difficulty breathing, you need to get medical help right away. To manage these symptoms, doctors often use antihistamines to dial back the allergic reaction and epinephrine for anaphylaxis. It's also crucial to steer clear of any known allergens to avoid these reactions. Quickly recognizing and responding to these gastrointestinal symptoms is key to avoiding serious complications and making sure you get the right treatment fast. Number 6, dizziness and fainting. Did you know that dizziness and fainting are serious symptoms that can show up during a severe allergic reaction? They often point to a big drop in blood pressure, something we call anaphylactic shock. These symptoms are critical and need immediate medical attention because they can quickly turn life-threatening. When you come into contact with an allergen, your body might react by releasing chemicals that cause your blood vessels to widen and your blood pressure to plummet. This sudden drop can cut down blood flow to your brain, leading to dizziness, lightheadedness, and even fainting. You might feel weak, confused, and unsteady on your feet right before you pass out. You might also notice other symptoms like a rapid or weak pulse, clammy skin, and difficulty breathing. These are signs that your body is struggling to keep the blood circulating properly and maintain enough oxygen. Immediate action is crucial. Using an epinephrine autoinjector can help counter the severe allergic response and stabilize your blood pressure. It's essential to call emergency services right away, as ongoing medical care and monitoring are vital. Number 7, rapid pulse and heart palpitations. Did you know that a rapid pulse and heart palpitations are key signs of a severe allergic reaction, often pointing to anaphylaxis? These cardiovascular symptoms show that the body is under significant stress and need immediate medical attention. During an allergic reaction, your immune system releases a flood of chemicals, including histamines, which make your blood vessels widen and your heart pump harder to keep up your blood pressure. This can lead to a rapid heartbeat or tachycardia, and may also cause heart palpitations, where it feels like your heart is racing, fluttering, or pounding in an irregular way. These worrying signs often come along with other symptoms of anaphylaxis, like difficulty breathing, swelling, hives, and a sudden drop in blood pressure that can cause dizziness or even fainting. Together, these symptoms can mean that your body is going into shock, and it's crucial to act fast. The first line of treatment is to use an epinephrine autoinjector, which can help stabilize your heart rate and blood pressure by tightening your blood vessels and opening up your airways. After that, it's essential to call for emergency medical help to get further care and continuous monitoring. Number 8, persistent cough or hoarseness. Did you know that a persistent cough or hoarseness can be major signs of a severe allergic reaction, often indicating trouble in the respiratory system? These symptoms can pop up when allergens trigger inflammation and swelling in the airways, which makes breathing tough. A persistent cough is often the body's way of trying to clear out the airways. But if it's part of a severe allergic reaction, it usually means the airways are narrowing and maybe getting blocked. If we don't deal with it quickly, it can lead to serious issues. Hoarseness, or a change in your voice, occurs when your vocal cords swell and get inflamed, which can make breathing and speaking difficult. These symptoms often show up in reactions to airborne allergens like pollen, pet dander, and dust mites, but also with food allergies and insect stings. They can get worse fast, particularly if they're part of a wider anaphylactic shock. Immediate action is critical here. Using an epinephrine autoinjector can help reduce the swelling and open up the airways. Antihistamines and corticosteroids might also be used to help manage the symptoms. It's crucial to seek emergency medical help to ensure proper care. Number 9. Conjunctivitis and eye swelling. Conjunctivitis and eye swelling are common symptoms of a severe allergic reaction, often signaling a strong response to allergens like pollen, pet dander, or certain foods. Conjunctivitis, also known as allergic pink eye, involves inflammation of the conjunctiva, the thin membrane that covers the white part of your eye and the inside of your eyelids. Eye swelling, or periorbital edema, often goes hand in hand with this condition, causing discomfort and sometimes even affecting your vision. When you have allergic conjunctivitis, you might notice redness, itching, and a burning sensation in your eyes. There might also be a watery or sticky discharge. Swelling around the eyes can make them look puffy, and in severe cases, it can even block your vision. These symptoms can appear quickly and might be accompanied by other allergic reactions like hives, a runny nose, or breathing difficulties. The first step in treatment is to steer clear of the allergen. You can also use antihistamines or anti-inflammatory medications to ease the symptoms. Applying cold compresses can reduce swelling and provide relief from discomfort. For more serious cases, doctors might prescribe corticosteroid eye drops to bring down the inflammation. If eye swelling comes with difficulty breathing or other signs of a systemic reaction, it could be part of an anaphylactic shock. This is a medical emergency that requires immediate use of an epinephrine autoinjector and urgent medical care. Recognizing the warning signs of severe allergies can truly be a lifesaver. Symptoms like anaphylaxis, angioedema, severe skin reactions, difficulty breathing, abdominal pain, dizziness, rapid pulse, persistent cough, and conjunctivitis all require immediate medical attention. Knowing what to look out for helps you react quickly and effectively, which could prevent serious complications or even save a life. If you or someone you know starts showing these symptoms, don't wait. Get medical help right away. Early detection and prompt treatment are key. Stay informed, be prepared, and always put your health and safety first. Don't forget to like, share, and subscribe for more essential health information and tips. Your health is important, and we're here to help you stay safe and informed.